So now I'm going to give oral hygiene instruction to the patient, and I'm going to start with the electric toothbrush. So we need to get the brush right down underneath so it's moving along the gum and under the bridge. And along the insides, getting right down low. Okay, and with the same with the uppers. Next, we're going to use the implant floss. Push it underneath and out the other side. Get to the thicker part, and then you can clean. And if you pull right to the side and out, and then do the other side of the implant and pulling this way, and then it will clean all the way around the implant. If the patient finds it difficult to use the implant floss, then you can use an interdental brush. And lastly, the tufted brush is very effective for cleaning underneath.